Okay. All right. I think everybody's here. Hi, everybody. Thanks for braving the rain, snow, fog to get here today. So I'm going to call the meeting to order. Our first order of business will be approval of the meeting from the January 25th board meeting. Motion made by Mr. Gandy. Do I have a second? Second by Mr. Seaman. Anybody have any questions or comments about the minutes? Okay, hearing none. All in favor, signify by saying aye.
Aye.
Any opposed? Okay, the minutes have been adopted. We have a couple of resolutions that are in your packet, and I think the first one will be presented by Mr. Gelia.
Yes, before you have a resolution under your public authority law, that particular law requires the resolution and approval of particular policies annually. We prepared a memorandum to the board on or about February 11th, outlining those policies, some of the changes there. We're asking for the resolution to, yeah, these are just annual things that. Questions?
Are there any significant changes? These are really just perfunctory things that we need to do on an annual basis to stay in compliance.
That is correct. The only substantive changes were the procurement guidelines, and even those were minor at best. Some were changed to be consistent. For example, the CEO's prior approval of emergency procurements, we put where practicable, because as we have learned during this pandemic, sometimes we can carry those. Usually, towns on a phone call as opposed to in person or something. So those were the minor changes there, but there were some.
Can I have a motion to approve the resolution?
So moved.
So moved by Gino, seconded by Sharon. Anybody want to further discuss the resolution? All in favor, please signify by saying aye.
Aye.
Any-
Got my board meeting on the go.
Oh, okay.
I don't think that was an opposed. So we're going to say that resolution was adopted unanimously. Next, we have a resolution receiving and filing the medical dental staff meeting minutes from February, and I think Dr. Murray will be filling in for Dr. Cumming.
Yeah, Dr. Cummings sends his regards. He's on a flight to New York City at the moment. In your package, you were provided with the Credentials Committee meetings for February, which were approved by the Medical Executive Committee last week. They show 9 initial appointments, 9 resignations, and 31 reappointments. The majority of the new appointments are APPs in a number of departments. There are 2 teleradiologists and one physician, Dr. Amy Stanislawski, who will be joining UPP in March and will be working in our CPEP department. Other features in the Credentials Committee I just want to mention is you may have seen some advertisements for Inspire on TV recently for the Inspire treatment for sleep apnea. That's something that we do here. Dr. Laurie has been doing it now. It's being extended to the Department of Otolaryngology as well. We're also working on developing privileging criteria for the new robot, the surgical robot, working with the relevant chiefs of service for that. And we're also working with Dr. Grimm to extend palliative care privileges to multiple specialties as a primary palliative care privilege. So those are the highlights. If there are any questions, I'll be happy to answer them.
Anyone have any questions for Dr. Murray? The approval of these minutes requires a motion by a board member and a second.
So moved.
So moved by Mr. Gandy, seconded by Sharon Hanson. All in favor? Aye.
Aye.
Any opposed? Okay, that resolution has been adopted. Next, we have Dr. Murray again, relative to the appointments, reappointments for chiefs of service and associate chief of service.
Yeah, as you will recall, I provided you with the annual slate for the chiefs of service last month. I'm sorry to bother the board again, but since then, Dr. Balos, who has been our chief of service in pathology, indicated her desire to retire and step down from the chief of service position in pathology effective March 1st. After consultation with John Tomaszewski, who's the chair of the UB pathology department, he and I are recommending the appointment of Dr. Yusuf Sufi, effective March 1st, as the new chief of pathology. Dr. Sufi is a graduate of the University of Sana'a. He did a residency in this country, and he's done 3 pathology fellowships, 1 at NYU and 2 at Roswell Park. So the chiefs of service are appointed by the board on my recommendation. I also will just, on the second page, Dr. Drumsta has requested that Dr. Tom Lestraco be serve as his associate chief of service, as there are a number of MedExec meetings he will not be able to attend in person. So again, I will entertain any questions the board may have.
Dr. Murray, are these faculty positions as well?
The chief of service does not require to be a faculty position, but they are both faculty members of the UB Department of Pathology and Radiology, respectively.
Are they on tenure track, you know?
Dr. Sufi is a clinical assistant professor, so I do not believe, I believe they are both clinical titles, and I don't believe that they're on tenure tracks.
Thank you.
Anyone else? Okay, terrific. May I have a motion to accept the appointments and reappointments?
Motion.
Mr. Seaman made the motion, seconded by Dr. Grimm. All in favor?
Aye.
Any opposed? Okay, resolution is adopted.
I thank the board.
Thank you, Dr. Murray. Okay, reports from the leadership team. We will hand it over now to Dr. Fletcher.
Okay, thank you very much. Carol. Go. All right, so just to update, obviously, on our COVID patients, we dropped significantly with the number of COVID patients in the building. We do have 5 patients who are affected. Some of those primary diagnosis of COVID, some are not. Right now, we only have 2 employees out, so we've gone from a high of over 200 to 2. So it's dropped very, very quickly. So that's very good news. Just a couple things to point out. We had our lab survey and also our outpatient dialysis survey. Both surveys went very, very well. We had a couple minor things that they recommended, but I just want to congratulate folks in the lab and outpatient dialysis because they were very, very complimentary of both of those services. We did have our January Nurse Hero, and you can see a picture there, Rick Federal and RN on 12 Zone 1 in their medical ICU. We have a Nurse Hero of the Month every single month. So we will obviously share February's coming up here, but Rick does a phenomenal job in our ICU. A couple other things around quality. Shirley Ludlow was appointed, as you know, as Senior Vice President of Nursing, and Casey Davis is Senior Vice President of Operations. Congratulations to some nominees. Some of you may know some of these outstanding nurses, but we have nominated for the Professional Nurse Association Award 3 nurses, Nurse of Distinction, Santasha, Outstanding Staff Nurse Heather, and Nurse of Distinction Education, Laura. So if any of you would like to go to that event, ECMC is the loudest table by far, with boat horns and all, and couples. ECMC patient safety indicators, we had a very good first month and our journey to zero harm and high reliability. And you can see some of the numbers there. We only we did have one surgical patient complication, but other than that, our patient safety indicators started out good this year. Human experience January scores. We continue to work on our patient experience scores. We're still at the benchmark of what's going on in the rest of the state. As you can see some of our previous numbers, we are starting to get back up to our previous levels. Obviously, with the long wait times we've had, it's been a challenge. The good news is this past weekend, our left without being seen was under 5% each and every day. That's a first. It's usually been about 20%. So now we're going to have the opposite problem, getting our volumes back to where they were. But it was good that people were getting cared for in a quick manner. Our Department of Defense has been assisting ECMC, as you know, and we've had a whole team here, and we got an extension, a 30-day extension. The team has been absolutely phenomenal. These are all clinicians, physicians, nurses, respiratory techs, and we've just been so blessed to be able to have them here and providing service for our patients.
Tom, how many of them are Western New Yorkers?
I don't know. That's a very good question. I didn't encounter anybody who was from Western New York. So
No, they're all from out of state.
Yep.
The ones from Terrace View, there were 11 out of 13 from Western New York, but this group, there was no one.
Did you say 11 out of 14? Andy?
13.
in Terrace View. So National Guard, a good segue to National Guard at Terrace View, and National Guard continues to help us at Terrace View. So
I think you should change the khakis.
I don't know. I went to the military. I thought I was going to start out. But Navy though. Ambulatory Nursing Care Week we celebrated, and here's the team. And again, team, we just continue to make sure we recognize all of our ECMC family members. Black History Month, we've been, Cindy Bass and her team have been very active at making sure that we celebrate Black History Month. And we've had a few different events, a spirituality and healthcare panel. We've been putting up legends in Black history, many of whom were in clinical positions up on our screens. We have a celebration here in the cafe on the 16th of February, and we're doing some Black health and wellness events also. And a couple other things that we're doing. We celebrated Pre-Anesthesia Nurses Week. We had all the executive team, the entire executive team here went out and distributed flowers to each of the units. Typically, we would actually hand them to patients, but because of COVID, we hand them to the units, and they went and gave them to the patients this year. Well, hopefully next year we'll be back at going room to room. But Karen and I were teamed up and went up to the 6th floor and the 10th floor to talk to the staff and have them deliver flowers to our patients in appreciation. We also had Thank a Resident Week to make sure we recognize our residents who provide great service here at the hospital. Just a couple foundation initiatives. Foundation has really done a nice job of adjusting to COVID, and has been doing some different events. As you can see, we've had a couple raffles. We have our ECMC clothing sale, which again, as we know, our ECMC family pays out of their pocket to have ECMC logo apparel. It made $17,000 on that event. And then for the annual fund, I'm very proud to say that 45% of the ECMC employees donated to the annual fund this year. And this is not a benchmark many hospitals share, but I would dare to say that this is probably one of the best in healthcare. It's very impressive, other than maybe a children's hospital or a cancer hospital. So just very impressed with the fact that the foundation has really shown the employees the value of the foundation to both patients and our clinical staff. And obviously in return, they're contributing and supporting the foundation. So just really impressive, and Sue deserves a lot of credit around that. Now, we have some upcoming events. We're going to be doing I think a gift gathering coming up, and also Spring Fest is set for May 14th. So we are planning on Spring Fest. And really look forward to everybody's participation. It is a long time coming that we can get back together as Springfest. As you know, elective surgeries resume, so we're back on track. We've been ramping up around that and getting back to normal volumes in our operating rooms. So Andy and the team have been doing a great job. We're continuing to advocate to New York State, as we've discussed last meeting. We've had $79 million come off our balance sheet in cash. We are advocating to be included in some pools of money that we have been carved out of. And so we're going to be continuing to advocate with the legislature around that and seeing if we can get back in. And I want to thank Jen and John and Ben for their work trying to help us get back into the state pools of dollars so that we can get some help and assistance from them. This is going to be a continued challenge for us. I think we've talked a lot to the second floor in Albany, and we've also talked to the Department of Health. We're in the process of talking to various legislators because we do need some help from the state to be able to continue forward. We also have not received, or John's going to talk about this in a second, our federal CARES Act dollars, and we're continuing to advocate. I know Senator Schumer has reached in, Congressman Higgins has reached in, so we're not alone, but we're hoping that those dollars will be coming shortly. And we are in the process of also putting together a nursing recruitment effort, and really our nurses talking about our culture here and what it's like to work as a nurse at ECMC, so we can continue to recruit and do a great job recruiting. The team's done a phenomenal job recruiting in this market. January statistics, unfortunately, still have a lot of red. January was not only a rough month for us, but I know for other systems in our community in talking to them. Our discharges continue to have been down because of obviously the inability to discharge patients into the community. We are down to, I think, about 40 ALC Andy patients today. So we'll continue to make sure we place people safely. A couple other numbers, you can see that obviously the surgery numbers down at the bottom there in the middle continue to be low because of the stoppage of elective surgeries, and we had 527 less cases from budget, and we have had a higher case mix index, so that's an indication of how sick patients are, but that's not going to be offset all those other numbers that you see there. And again, the admissions to the ED is just a function of that high left without the seeing number that we had seen in the past. So with that, I'm happy to answer any questions that anybody has before John gets into the finance dashboard.
I was just wondering, that's great news about the lower rate of left without being seen. So do you, in light of that, do you think that that's because placements are getting a little bit easier? So we would expect that these numbers might turn around?
So I think it's a combination of two things. I think it's a combination of, frankly, less people coming to the ER because they're sick and waiting. So our actual numbers of patients coming to the ER has actually gone down, and we've seen a decrease in that. So if we typically were in the 170 range, we've been now seeing it the 130 to 140 range. I think that will probably pick up as time goes on. And the second thing is the ALC, being able to move patients through quicker. It's not just ALC patients are those who've been here for more than 20 days, but there's many other patients that have been here a lot longer than, especially the COVID patients, a lot longer than a typical patient. So we're moving those patients and discharging those patients a lot quicker too, which obviously helps free up beds for people to move upstairs quicker.
Tom, do those patients at any point qualify for TerraSU?
They
Or is
do.
that a function of
TerraSU is
care?
full, so that becomes part of the problem. But we do admit patients to TerraSU also, but it's just not enough beds at TerraSU to be able to
It's a volume
accommodate
issue.
the volume issue, correct. And a lot of the ALC patients, they're not only can be nursing home patients, but a lot of behavioral health. We do have some individuals who are developmentally disabled who've been here a long time because we can't get folks in group homes. We had the psych center here in Buffalo stopped admitting patients because of staffing last week. We had some patients go to other centers in New York State. So it's been a consistent challenge, and again, it all revolves around the staffing outside of the building. It's really what the reason is.
So they have the beds, but not the people to take care of it.
Correct. Any other questions?
Tom, I'd like to know about our telemedicine. Are we working that in our ER, and do you have any status update on that?
Yeah, I don't know if Karen or Andy want to talk about that a little bit.
I'll talk briefly. I don't have the stats in front of me, but we have been working with UEMS on telehealth services. We have an agreement with them, and Keith Cassie leads our digital health. We've expanded the telehealth services in family medicine and graduate Dr. Redhead's one of our largest users of telehealth. So we continue to see that someone in the ER, a little bit more in the primary care clinics.
Yeah, we it's kind of hard to get people to change their habits around the ER. And we have been advertising, we do encourage it. But for our population, it's been hard to get people to change their habits of coming here. So we continue to market it. You see others are doing the same, but I think, as Andy said, it's been a lot more successful in our primary care arena than it has been in the emergency room. Although some people do avail themselves of it.
Does it make sense to look at Garrison from a growth standpoint? Does it make sense for us to look at maybe more beds there? Is it, or you think we're pretty solid under normal circumstances? Because it was pretty much full before this hit.
Yeah, I think we're going to have some opportunity with staffing. I think we have 1 unit right now with ALC patients, and we're going to be able to expand back to where we were before. To your point, we've reduced the number of beds just from the staff. So yes, I think we're going to be able to open more beds moving forward here.
We're trying to expand recruitment, obviously CNAs.
No, I understand that staffing's an issue.
Yeah, if we can get more CNAs, then we can certainly increase more beds. But seriously, limiting the day, we get some staff, we probably open up 25 or 30 beds. So that make a big difference. But yes, the CNA market is very, very difficult.
Oh, I got to say the team's been successful in recruiting in that area recently. So.
Is there any virtue, or have we had any conversations with the nursing homes and or skilled nursing facilities about that whole transfer issue? Are they organized, or is it all the privates versus the state fund? I mean, how does that work?
Yeah, our challenges with them have been the staffing piece, right? So they only have so many beds they can staff, and they have requirements now under New York State. The second piece, and we're going to go on a little road show to talk with them. Andy talks with them all the time, but I think we need to kind of get out and try to be creative. The weekends are tough. There's really not a lot of resources, a lot of admissions that go into the nursing homes on weekends. So we're going to try to see if we can get creative with some models, but that's kind of the next step. But the staffing issue has really been the limiting factor in their inability to recruit.
So the same deal, they've got the physical space, but not the people.
Correct.
So if we had the people and we were full of capacity at Terrace, what would be the other choices of these people that we're accommodating that may have to be put there because there's nowhere else for them to go? Where would they go?
Yeah, other places in the community do take the patients. Normally, before COVID, we actually were doing a really good job of coordinating all that. Actually, had hired an individual with Kaleida, and we were kind of working, and we continue to work together on that. There's more than enough bed capacity. It's just the personnel. So those folks wouldn't, and those homes do take individuals. I mean, there's no more. We can expand the physical, space, if you will, for if we get more staff. But there's no more physical space to be able to expand Terrace Street, for example.
Yeah, and from our conversation with Dr. Shields and Tom alluded to, when we started the long-term acute care service line, he was expanding tremendously with Elderwood and Absolute Care. So, but the issue is not the beds; it's they have the same issue. The issue is having enough staff to be able to take care of those patients. Elderwood and Absolute, others have the same problem. That's the rate.
Yeah, there's enough capacity in the community. It's just a staff issue.
Any other questions for Tom? Go ahead.
So I won't rehash too much of what Tom identified in this slide, but it's just worth noting that, as we had anticipated, the challenges we saw the last couple months especially in December, did continue into January, especially on the volume side. So you see inpatient discharges down about 25%. Again, the surgical cases both in and out patient, 37% and 47% for a combined 43%. So when you really step back from that, add into that the fact that our length of stay is at 11.3 days, just causing additional costs without any additional reimbursement. The revenue impacts here are significant. So those coupled with additional costs on the staffing side, premium side, did result in an operating loss for the month. But these revenue figures here in these statistics drove a variance from revenue of close to $7 million per month. Just on the next slide. So you can see here that that plus additional expenses, as I mentioned, resulted in a loss of about $10.8 million just for the month. We did budget about 1.7, which we'll show in a moment. But again, that's really being caused by the revenue side. The revenue is the biggest driver. But with the additional expenses, did bring us to a significant loss. A couple other items to note here. FTEs are down below plan. Again, not by design. We're trying to fill those spots. I've been doing a better job, obviously, the last couple of months with some significant recruiting classes coming in. But still for the month of January, still well below our target. Days cash running a little bit higher than our budget. But again, that is temporary in nature, obviously, and that's been decreasing over the last several months. We're expecting that to decrease going into the near future, just based on paybacks that we have of the Medicare loans, as well as just ongoing operating expenses. Next slide. So as you can see here, our overall loss from operations for the month was about 10.9 million. We had anticipated 1.7 million. So financially challenging month for us, both operationally and non-operationally. You can see here we did take a temporary hit in unrealized losses in the investment markets as well. Next slide.
John, how does this impact our 79 million?
So those losses are in addition to the 79 million. So again, those are really primarily cash flow impacted losses for the month.
We need to adjust.
No, which I think we can talk about. I think well, maybe now is a good time to talk about it, just as any. It's sort of what the executive committee report would be about. So to address John Dandy's point, we have been advocating for sort of a pot of money of $79 million in one pool in the New York State budget. And thanks to everybody who has worked so hard in doing that, and we'll continue to do that. But those are that's a Medicaid lump sum payment that is ideally would be coming to us at one time just for this 1 year. And if we exceed that 79 million from that particular designated dollars, right, those Medicaid dollars, then we start to run the risk that we're going to have to give some money back, which we never want to talk about giving any money back. And I'll talk about that in a minute, but just to answer John's question, we don't need to adjust our, in my opinion, I don't think we need to adjust our $79 million ask from that pool. But there are several other avenues that John can probably talk about maybe when you're done with this, that we're looking into in the budget to recover more monies. And so when you're done with this, maybe you could just take a quick run through.
Is this our biggest monthly loss?
Since the pandemic started, no, but it's quite sizable, and the reason is because
It feels that way.
it is more significant than those that we've seen recently with the shutdowns. But in addition to the shutdowns, we've also had the staffing issues, so we've had to incur significant premium costs to be able to even staff for the volume, and the challenges that we're seeing outside of the organization placing patients, driving those costs up internally have really caused a larger number this month.
So John, we talked about this I kind of used May 1st as an example of maybe this being cleaned up as clean as it could get and having a better picture of where dollars will be coming from. But having a picture of the revenue coming in at the same time, not having to pay for additional dollars over and above staffing, because we should be able to continue the success that we've been having, hiring people. So would that be a fair guess in regards to a month that we could see something normal? And I guess I'm saying COVID's going to continue to get better, right? I mean, if that's all going on, I'm just trying to say, so you figure we're into February, so we didn't get it. We didn't have any revenue in February. So you're going to have the same numbers probably carrying forward that we're seeing now.
Yeah, really, I think it's really going to come down to staffing. I think the volume will start to slowly turn the corner.
Okay.
On the surgery side.
Right.
But on the staffing side, that just takes time
Right.
to get.
That's what I'm saying is
To be able to staff the
So is, and I don't want to hold you to May, June, July, but I'm just saying, is that reasonable that we should be able to work our way out of this? Or do you think we still need more
I
time than
think
May?
it's two things. One is, we got to obviously federally what we get from the CARES Act dollars, but if we don't get help from the state, we're going to have to make some decisions to cut services. And so we're already having those conversations to be able to plan for that. But that's where we're at. And we've been very vocal, both, publicly and also with the elected officials around that. But we're going to have to make some decisions, which we'd obviously, bring back to the board. But we're going to have to start looking at those. And we're already starting to at some level. So, we want to get ahead of this, and we're hopeful, planning for the worst, hoping for the best. That our legislators will come through for us and make sure that we get access to the dollars we frankly deserve to have access to as a safety net hospital. But if we don't, we're going to have to take actions to be able to smooth this out a little bit.
Yeah, so I mean, I think, there was, as John Sly was indicating, it was kind of a perfect storm of having to pay, $1 million a month in nursing agency staffing costs, not being able to discharge patients while you're still having to care for them. So you have to pay the expense of the people who are caring for them, but you're not getting paid to have the patients in the facility, and you can't discharge them because there's nowhere for them to go based upon staffing difficulties. So that's why we are spending so much time and energy on the advocacy piece. And, to the extent that any of you run into your local legislators, feel free to remind them that this is an essential service provided by ECMC, and really we are at a point where if the state doesn't release that money to us, not only the 79 million, but some of the other things that John's going to talk about, but the 79 million is like an emergency lifeline that is essential. There's no other way to put it. I mean, where we're going to be facing dire decisions that nobody wants to make, but we have to plan for that if those funds don't come through. So we're working really hard to get that done. But Mike, to your point, even if we fix all the operational things that are happening and things start to loosen up a little bit, if we don't get an infusion of cash from the state, we're still going to be.
And this area is the number one reason is the stoppage of surgery so many times. And we've faced this in Western New York more than any other part of the state. So that's been that alone just in revenue is 68 million. So, and then we have obviously wage inflation. We have the inability to discharge patients, and obviously left without being seen as a result of that. So it's a combination of all those things, but the surgery piece has been the biggest portion of that in the Achilles heel, which was generated by the state. The state was the one that canceled.
Well, I guess where the question,
but
the question where it was really going is that we're going to get a good feel of how well we're doing with our surgeries and how well we're getting back to normal of what we do business, how we do business. So I want to look at that piece, and I understand the other pieces have to fall in place, but if taking that part, is that enough time to realize if there's no more hiccups out there with COVID, that we should be up and running with elective surgeries going full speed.
Yeah, well, we can't, the elective surgeries won't help us fast enough.
Okay, that's,
So that's why we have to take other actions.
Okay.
It's just not, you know, from a reimbursement standpoint, our reimbursement mix is, you know, not good. And I think, you know, we've been very vocal about where we stood last year. I think you're gonna, excuse me, see the other systems, Catholics especially, I think are gonna have a significant, you know, they were at 63 million, I think, after the third quarter, if I remember correctly. So I can't imagine the fourth quarter was much better considering surgeries were canceled. And I'm sure that, you know, the collide will be somewhere a little bit, maybe if you look at our operational loss versus our kind of, you know, total loss, somewhere close to where, you know, half of maybe we are or where we're at. So I don't know exactly, but their audit's not done, but we're not alone. It's just a picture. Our issue is we have higher Medicaid, and it's just a lot harder from the reimbursement standpoint.
We've indicated that you're already having conversations about possibly cutting services. Is there a time frame on that?
Yeah, I think in the next couple months, if we don't get help, we're gonna have to start making some decisions. So we're looking at April. Making those decisions.
So Mike, I think that probably wasn't, not exactly what you asked, which is, you know, by May, we might not be getting the money.
It's the run rate.
But
Right.
yeah, we might be, it's a yes and no.
no, I got
Like
it.
I'm talking like such a
Yeah,
lawyer
I'm
right
sure-
now.
I asked the questions just because, you know, there's new board members,
Yeah.
board members that weren't here when we were doing well. And, you know, we're clawing our way out of here and we know we need help to get out. Is there some, and I do feel confident with all the people that are working together that we'll get these dollars that are necessary, but just to give everybody a feel, you know, a revenue cycle of a normal month for us. Would that be, you know, a good month to say we should see a normal revenue cycle in that month? And I think people then can put together, wow, that's the impact it's had over the last, you know, 79 million later, on top of other issues.
Yeah, I mean, we'll have to see.
Yeah,
We'll have
I
to
got
see
you.
if it's
Okay.
really, if that's.
But I think what you're
Doable
saying
that
is like, would we be able to, if everything goes outside of the, you know, dollar from the state, will we be performing surgeries at a level that we performed them
Yes, that's
in May? But like, we might not get paid for them, but that's really your question. Like, will we, we should be, I think,
Yeah.
ramped up enough to be at that level. We might not be getting the money for them in May, but I think you're right. Yeah, that would be good.
Okay.
I think.
Yeah, it dragged on a little longer than I thought.
No,
No,
it's good.
I
It's
mean,
good to talk about it. So
It's nice to talk about getting back to normal.
Nobody's surprised.
So the issue then becomes, assuming that we get either the 79 million or some portion thereof, that fills one gap. But at 10 million a month, to Mike's question, you will never catch up and play from behind all the time. And so, you know, that is as big a,
It'll give us
I mean,
runway to recover.
which nightmare do you want to have?
Yeah, it'll give us runway to recover, to your point, John. It'll give us runway to recover.
And there are, you know, and Mike, I'm glad you raised that point especially for our new board members. You know, these are challenges that we've been living with now for, I've lost track of time, but it wasn't always this way, right? That it's a very successful organization pre-pandemic, and it still is a very successful organization. Don't let the numbers fool you. The numbers are what they are, and you know we will fight to get back to a place where we're not in the red. But it isn't for lack of trying, and the level of care that everybody has been providing during this really difficult period has been amazing. So for those new members and our longtime members, I think the staff here has done an amazing job with, you know, hardly any resources. And then we'll fight for the rest of the money.
Has our cash flow or cash management been impacted by it? I mean, are we 10 days and 30 days and I mean, we're paying our bills?
Yes, we are. We're paying our bills. We have adjusted it slightly over the last couple of years.
It's like being a little pregnant.
We've adjusted it where we need to adjust it, but without impacting any.
Like
clinical
either or,
operations.
Well, we've been playing, I mean, in the market, we've been probably one of the faster players in the market. So
And we still remain one of the faster.
correct.
Our average days outstanding is just over 60 days. So in this market, that's,
So you may be, you know, this is Western New York, so you may be hearing a little bit of, you know, grumblings around that. So you're just gonna, you know, thank you for asking, because you're gonna obviously have to continue to say, well, we're in tough financial times and we need to manage our cash.
You blame it on it.
You blame it on John.
wouldn't be the first.
Well, I didn't mean to,
Oh, no, that's
totally
okay.
sidetrack you there, Tom.
That's okay. So just keeping it in front of us, just flip the calendar on the COVID update. We're still gonna do this for the board and our committees, just to bring an update back of our total impact. So the total impact through the end of January, it's about 131 million of COVID-related impact for our organization. We are gonna revamp this a little bit going forward, start to include some of the, I'll call them indirect costs that are, you know, tangentially related to COVID. For example, we don't include here the costs related to the temporary agency nursing cost staff that we've been incurring the last several months, but we will start to include those. Although they're not directly related to COVID, they certainly, you know, are impacted by it, whether it's the vaccine mandates or inflation or the, you know, the wage changes that are occurring just to drive some of the staffing changes that we're seeing. So we will start to include those.
Is Andy's fire included in there?
This is
Andy's fire,
and his fire. I don't think I have that in here.
the PPE stuff, has that been resolved?
Oh.
Oh,
Or are we still fighting?
Andy,
I think call it mine.
we are still fighting.
You paid attention. Have we settled that?
Not yet been settled, correct, Joe?
Correct.
But we are still fighting.
Is that about $1 million?
It's over, yes.
I don't know, I think I saw his head move like.
he said it's over.
The
$1 million.
total loss was $1.5 million of inventory.
But that's not in these numbers.
No, it's not in these numbers. The cost of, let me rephrase that. The cost of the original PPE, when we spent it, was in these numbers in 2020. So it's in the 131. But
We haven't
the
done.
loss and the the repurchase is not in these numbers.
Right.
So
Because we don't know how much of it.
we don't know how much the net will
That'd
be
be
that
right.
we'll recover.
Come on.
Somebody's not on mute.
Okay, so next slide, just a couple of updates. So as Tom said, we're still waiting a resolution and to hear from HRSA on our phase 4 CARES Act application. That is roughly 20% of applications that they're still reviewing that we're hearing. As Tom said, we've reached in through our associations, who've reached in through Senator Schumer's office, Congressman Higgins' office, all getting the same feedback that we've gotten, which is if you haven't heard yet, either way, your application is pending and is still under review. So that's ongoing. I do anticipate that will payments will be made in the first quarter. They've hinted at that, but you know, again, it's really just a wait and see at this point. Our FEMA applications are both the first one is in process. It's nearly completed. We have had some success recently where we had to go through an appeal process for some costs that were originally in a preliminary denial stage. We won that appeal, so in the full application is now just in its final stages of review. That's the last stage before payment.
What's that first FEMA application? Can you remind me of that
The amount?
number? Yeah.
It's like $2.3 million. We focused it in on like 4 months of PPE only. 3 months PPE only. Tom already referenced some advocacy on the budget side. Aside from that specific item, we're also looking at other funds that are in the governor's executive budget, health transformation fund, other capital funds. There are rate increases that are also included in that budget. But we're also looking at talking to the state, we have been for a while, about structural changes in different areas that they can help us with our longstanding legacy structural deficits that we've had related to benefits, as well as other related costs, because we kind of spun off and continue to be a public entity. So those are some of the long-term pieces. I don't need to get into specifics unless anybody has any specific questions about those, but I'll stop there before I hit the audit. Okay, the last is our RSM independent audit design going very well. And you should have the final report at the next board meeting in March, where they'll deliver the independent audit report. But at this point, no significant issues have come up that are worth reporting to the board at this point. That concludes my report. Any questions, be happy to answer.
Any questions for John? Thank you very much. So we'll just use the reports from the committee chairs. I can say from the executive committee standpoint, we have just been talking about money. That's what's, I mean, it is what it is. We have worked very hard to, and this doesn't need to be a civics lesson for everybody, but just so you understand what's going on behind the scenes, the executive budget from the governor was released on January 18th. Between January 18th for 30 days until February 18th, the executive can simply make amendments to her budget kind of as of right. We submitted some amendments. So in that budget, there were some amendments to the public health law, and we saw an opportunity there to amend those amendments to include us into the pool of money that has the $79 million that we're looking for. I won't bore you with the details. Happy to share the proposed amendments that we made. If any board member is interested, just shoot me an email. I'm happy to share it with you if you need some nighttime reading for bed. But our goal was to get that amended legislation to the governor's office before the end of the 30-day amendment period, not with any real hope that we would get into that amendment package, because typically those are technical amendments that address typos and oversights. But it gave us an opportunity, yet again, we're trying to do as many touches as we can. So that was a great opportunity, and thanks to everybody who worked so hard to get that to the governor's office. And we made our needs very clear, and we've continued to do that with our majority leader, People Stokes. We've had good meetings there, submitted the same proposed amended legislation to her office. We will be reconnecting with them, I would imagine, either later this week. They're in recess now, but we'll see if we can get a hold of them. If not, definitely next week. We have some additional meetings set up with other legislators, and so we've been focused mainly on that. That is not to say, and I don't want anyone to think that that's we're giving up on that, right? That is one way that we could hopefully get the lump sum payment that we need immediately, or as immediately as you could get out of Albany. If we wouldn't see any of that money until after the adoption of the budget on April 1st in any event. But as John was mentioning, we're investigating, we're in the weeds in the budget, and we are investigating everywhere there might be a spare dollar. So the team, thanks to everybody, we've been working really hard at that, and I appreciate all the support. And if you bump into any of your local legislators, let them know. Other than that, I don't think we talked about anything else in executive committee that was of any importance. So does anybody have any questions? Okay, Mr. Seaman, would you like to talk about finances some more, or are we beat that horse to death?
I think we beat it up pretty good.
Okay, and then we will consider ourselves enlightened on our finance. Mr. Bennett, are you with
Yes.
us? Hi.
Hi,
Sorry that I missed the building and grounds meeting today, but I'm anxious to hear about it.
it was pretty much a housekeeping items that we have. No major projects are being done right now. Interesting, the ER has the continued situation with the frozen pipe, getting that fixed, which has to be done. The minor projects include the tray line that we've talked about before. And in the end, one of the questions was of the bond money that we've spent, where we spent it. It sounds like 57 million went to the ER. So interested in finding out the others, but it's pretty much gone. So we don't see any major projects on the horizon, and that's probably a positive. That was our meeting.
Anybody have any questions? Okay, thank you, Mr. Bennett.
You're welcome.
MWBE committee report. Bishop, are you with us? Okay, we'll
Just a comment on that, Bishop wasn't able to be with us, but Dr. Grimm actually chaired the meeting. So
Yeah, I would just, I'm sorry, I didn't know I would be here giving a report, but I can just say that the MWBE committee has done a phenomenal job of really supporting the work of the MWBE initiatives. The numbers that we saw were not only encouraging, but something we could brag about. After the financial report, we do have things we can brag about, and that's one area that we've done very well. So kudos to the team for the work they've done.
nice to have something positive to talk about.
Yeah, it was very encouraging.
But we'll get there again when everything's positive. Mr. Holford, Quality Improvement and Patient Safety Committee.
Yes, I unfortunately wasn't able to make the meeting, but I do believe the information is in your packets.
Okay, fair enough, and I'll refer everyone to, if they have any questions, to review your materials, and feel free to reach out if you have any questions about that.
Thank you, Madam Chair.
Thank you very much, Mr. Holford. So that brings us to the end of our agenda. Does anybody have anything that they would like to talk about?
I'd like to extend my thanks to Andy Davis for participating at the Health Sciences School. I had a couple of calls about your performance, and it was all positive. And
I held my breath for a minute there.
No, I'm not going to give him any details. I'm not going to embarrass him, but I do want to let him know that there are eyes on him and ears are listening to what he has to say.
Did he dance?
And he didn't dance. I understand he did a little singing, but again, I'm not going to get into that.
Did this have to be a recorded event?
It was not, you know, they were wise and not recording it. But that school is so important to us right now, because as we move forward, we're going to have to build a newer model to get more nurses and other healthcare workers in our future. And that's one of the schools that are concentrating on that. So I know many of us board members don't know that much about the school, Andy. So maybe in future meetings, you can talk a little bit about that. Because where are we going? We're worried about nurses for today, but what about nurses for tomorrow? And the school is working in that area. And there are other things that we need to let them know that they can do besides being nurses and doctors. So I'm very excited to hear about it. I attended a meeting with a few members, and I was very happy to hear about what's going on over there. And I encourage you to keep on. If there's anything that any of us can do, please don't hesitate to let us know.
So I appreciate it. Obviously, ECMC was a charter member of the school, and actually we have a board seat. So I chose to fill the board seat, and I think it's a very worthwhile endeavor. We do have some initiatives or some meetings coming up with them around how we help some of the students, look at careers, things of that nature. And it was, I enjoyed it. I guess it appealed to my education piece. My mother was a 30-year educator, so it's been good. And it's a school that most of the kids, like especially athletic events, have to take 2 to 3 buses to get to the gym. They play all of their football games away, and they are in the basketball playoffs. First playoff game is Thursday night, so hopefully they'll win. It's amazing. And they have no gym, so. And one of the hopeful things I told them in the future is that maybe we could figure out a way to build a gym. I just never thought a school would not have a gym. And so thank you for that. And we'll keep working. And it's a good school, and they think very highly of ECMC. I'm just proud to represent ECMC.
Like I said, many people don't know how involved ECMC was in creating that school. But had it not been for ECMC, it wouldn't be a health sciences.
In the
So,
charter.
yes,
The charter school.
yes. So I just wanted to let Andy know and all of you know how much it's appreciated in the community.
It's terrific, and ideally it would help us from making the same mistakes that have come home to roost during this crisis. I'd like to hear more about it. Andy, would you be up for maybe giving us a little more information at the next meeting?
Yeah, happy to do so.
And there's probably you'll see.
We're both, we hear the singing on the 3rd floor.
Thank you.
We want to answer.
Thank you very much. Anyone else have anything they want to talk about? Okay, well then, I would entertain a motion to adjourn.
So moved.
Moved by Gino, seconded by Mr. Stevens.
Is that a record?
Ah.
Is it a record already?
Well, right. Well, first let me say this, we are adjourned.